This is a presentation about the relation between the cardiac cycle and the ECG trace, and it was made by Anna Zamir and Danielle Beachy. ECG stands for electrocardiography and is the primary way to diagnose cardiac abnormalities. To understand ECG, we first need to know about the anatomy of the heart and the cardiac cycle. These are the right and left atria, and these are the right and left ventricles, separated by the septum. In each cardiac cycle, an action potential propagates through the heart, causing the atrium and ventricles to contract and pump blood around the body. The action potential starts in the SA node, also known as the pacemaker. This is short for sinoatrial node. This depolarization wave then propagates through the atrium, reaching the AV node. Here there is a delay in the propagation of the signal to the bundle of His, which then separates into the left and right bundle branches and then to the Purkinje fibers, all surround the ventricles. The depolarization wave, which causes the ventricles to contract, is then followed by a repolarization wave, causing the contraction to stop.
An electric dipole moment is defined as the charge times the distance from a negative charge to a positive charge. An action potential is just an electrical signal propagating by a current flow. The direction of the net current flow, which is the movement of negative charges, is therefore equivalent to the direction of the net electric dipole. In general, by placing a positive electrode and a negative one, the voltage difference between these two locations can be measured. A positive voltage difference indicates a current flowing towards the positive electrode.
A typical ECG involves three groups of leads. There are three limb leads placed on the left arm, the right arm, and the left leg. There are three augmented leads connected between the limb leads. There are also 6 chest leads placed at different positions across the chest. The different positions of the leads provide more information about the heart, since different parts of the heart can be seen better from different angles. To understand how this relates to the ECG trace, we will now focus on one of the chest leads.
A wave of depolarization acts as a movement of voltage known as current. When current flows towards an electrode, it causes an upwards deflection on the ECG trace. When a current flows away from the electrode, it produces a downwards deflection. When there is no current flow, the ECG trace returns to zero.
The ECG trace shown here belongs to the V6 lead. Since the left side of the heart has more muscle mass, the net direction of depolarization and repolarization are both to the left. When directed towards the electrode, depolarization is seen as a positive deflection, and repolarization corresponds to a negative deflection. The P wave represents the atrial depolarization. The QRS complex represents the ventricular depolarization, and the atrial repolarization is masked by the QRS complex. The T wave represents the repolarization of the ventricles.
So normally, an ECG trace will include all 12 lead separate traces. All of the traces show the same electrical signals, but they are all seen from different angles. By knowing how the trace of a healthy heart should look, anything which differs from it could suggest an abnormality that should be treated.